Anti-aging tips for your lips versus your skin. So as we start getting, actually it's not we in Southern California, but the rest of the country starts to get into colder weather, drier weather. Some people will start experiencing dry, chapped lips. So I'm not only going to talk about the differences between lips and your skin and why the care has to be slightly different, but also around the border, the perioral area around your lips. So stay tuned. We're also going to be talking about pro tips on how to take care of your lips during this season. Hi, my name is Christy, and I have been treating clients for actually almost going on 12 years in the areas of acne, hyperpigmentation, and other skin conditions. So we're going to be talking about the tender areas of your lips and, of course, the differences between that and your skin. Just slight changes. So your lips are typically softer and more movable than your skin. So to give you an example of the differences, your lips have about 3 to 5 cellular layers versus your skin, which has up to 15 to 20 layers of skin. Your lips also have fewer melanocytes than your skin, which is why typically you don't see your lips turning brown. However, over the years of treating many clients, I've actually seen some clients that actually had freckles on their lips. So not just around their lips, but literally on their lips. So sometimes you can see that as well. But for the most part, lips are not affected by pigmentation. Now, unlike the skin is covered with sebaceous glands, sweat glands, as well as hair follicles, where that typically stops at the border. So where there is that thin line where the skin meets the border of the lips, that's actually called the vermilion border. So obviously your skin or the lips of your skin don't have any hair follicles, sebaceous glands, or sweat gland, which is why during the winter months when the air becomes very dry, a lot of people start experiencing dry, cracked, chapped lips, and for some people they will actually start to see aging around the upper lip area with fine lines and wrinkles. So because our lips don't have any sweat glands, sebaceous glands, or hair on our lips typically feel more sensations of hot and cold, are more susceptible to infections and dryness. So if you folks are finding this information helpful, you guys like product reviews, the correct usage of products, as well as ingredients and beauty news, and you haven't subscribed, please click the link below and give us a thumbs up on this video. Okay, so going back to the vermilion border. So that is that reddish thin line, that border in which the skin meets the outlines of your lip. That color comes from a intracellular protein called elidin, and that is actually where you can see the red blood vessels come through the papillary layer, and that's what gives it that red blood cell color. So as mentioned earlier, your lips don't have any sebaceous gland, which is why it cannot moisturize itself. So the problem with most chapsticks is that chapsticks are made with wax or occlusive agents, and so they could be petroleum, petrolatum, it's basically the same thing, but it's under a different name, or waxes, and those basically keep the moisture in. Well, the reason when you have chapped lips and you're putting chapstick on there, all it ends up is, along with the flaky lips, is the chapstick starts to flake off, is because a lot of that is just occlusive agents. It just basically keeps the moisture in. Well, when you have chapped lips, you don't have any moisture. So you want to look for a lip product that has hydrating agents as well. I personally prefer a gel-based lip treatment along with some peptides in there for anti-aging for the lips. So read the ingredients on your lip product. A lot of the chapsticks or a lot of the lip products are higher in emollients and occlusive agents. And if you're not sure, some of the examples of emollients and or occlusives can be, like I had mentioned, lanolin, petroleum, oils, waxes, and even alcohols in there. Cetearyl alcohol, which is a waxy substance. So here is a pro tip on how to deal with or how to treat dry chapped lips. So obviously this is my client Fatima. We're actually going to be doing a microcurrent treatment a little bit later on, but she volunteered, and obviously if you look at her lips are not dry or cracked or peeling. But let's say you have a lot of that flakes there, and so when you're using a waxy chapstick, all that ends up happening is, because waxy chapsticks are full of occlusive agents and some of them have emollients as well, they don't have any, most of them don't have any added humectants or very few. So what ends up happening is in the chapstick, because it doesn't have any, the lips don't have any moisture, you're not adding any, is the chapstick dries and flakes off, and so now you have more cracked and peeling lips. So the chapped lips never heal. So one of the things that you can do is, obviously she's got nice smooth lips, but if she had dry cracked lips, you want to use an exfoliating powder. You don't try to avoid any salt scrubs or sugar scrubs or any kind of harsh scrubs. So this one is an exfoliating powder that I have here that I'm going to work up into a watery paste. It does have more gentle fruit enzymes, and it has lactic acid, which is an AHA, but it's actually a very it's a very hydrating and very gentle acid. So I'm going to work it up kind of like a watery paste. Don't lick this, okay? So we're going to put it right on her lips, like this. See how it's just kind of like a watery kind of paste? Now, if you have very chapped, dry lips, you want to get a lot on there because you got a lot of dead skin on there. And the instinct when you have dry, chapped, cracked lips is you want to lick it. And that is the exact opposite of what you want to do. So you just want to go in circles, just gently. And actually, it might help to even go right outside of the lip area, too. And you just want to work it. Because it has fruit enzymes, you actually really don't need to move it around a whole lot. And that's the difference between a sugar and a salt scrub. There are no exfoliating ingredients, so you're using basically physical abrasives to try to get that off. This, I'm just using a little bit of movements because the fruit enzymes are keratolytic, so they're eating the dead skin cells, and I'm just basically helping it by removing all the rolls. So I don't know if you can catch it on the camera, but I'm already seeing just some skin come off on the top here. It's more on her upper lip up here. You see the little rolls here than on her lips. So you just want to do it for just a few minutes. See how it's kind of drying on there? If you have really dry, chapped lips, you just want to keep adding a little bit of water and keep working that through. Like this. If you're doing this from home, you can just do this, just kind of wipe it down. And what I like to do, so I'm going to go get a hot towel. You can get a wet towel, a washcloth, and you just kind of, is that too hot? You just kind of wipe it down. So all the dead skin, I don't know if you can see all the dead skin is on the towel. And it just kind of wipes it off. And you may need to do this several times if your lips are extremely chapped. Now, in the treatment room, I actually like to use a gel-based mask and just leave it on there. And if your lips are very dry and dehydrated, a lot of times your lips will just absorb that. You can't do it with every single gel mask because it's not meant for lips, but I do that in the treatment room. So then while her lips are still moist, you can put the lip treatment that I mentioned. I will put that in the description below, but I'm going to put on a hydrating, just like a little lip tint. Ooh, this color is actually pretty on her. And see how her lips are nicely smooth and hydrated? So that is a pro tip for you all. Then what I personally use is I actually use the Ormetic Balancing Lip Enhance Complex. It is a gel base. You can put that on your lips, and I actually put it a little bit above, like on the vermilion border right there, so it extends past it when I go to sleep, because those are the areas that get neglected. They get thinner and you start to see the fine lines on there. So then you can apply something like this. I'll put the link in the description below, and you can use this. So a lot of people really like this Ormetic lip treatment. I have used other ones where it's a gel, it's just, so you have to be careful. There are some hydrating lip treatments that actually say that they're hydrating and they are moisturizing. It is gel based. You put it on and it doesn't help. A lot of times the reason why is because those products are higher in oils. And you have to remember that oils are both emollients and occlusives, but not necessarily, they don't have any humectants in there. So you have to be careful with that. So as we age, for those of you who are more mature, you already know that around our lips, it actually does start to show aging a little bit earlier. I would say right behind the aging around our eyes. So you'll start to see the fine lines and wrinkles, and so we start to have collagen loss. The lip region actually develops deeper wrinkles, measured about 250 to 400 micrometers. Obviously, there are several treatments to treat the aging of the lips, you know, whether it's the wrinkles around the lips or thinner lips. And I'm going to be showing you one of them in the treatment room right over here. So this is Jessica. Jessica is 40 years old. So in another video, I'm actually going to show you the process of how her skin improved as far as texture and tone. When we first started this, I had to spray her continuously because her skin was so dehydrated. Now her skin is nicely hydrated. So I'm going to start the process. Now we're going to do the upper lip area right here. So this is, we're going to spread down and kind of go down. So this is very good for people who may have fine lines and wrinkles right above their lip line, as well as what's known as marionette lines, and just helps increase the muscle tone there, because on your face the muscles are attached to your skin, unlike on your body, which is normally attached to bone and tendon. So please remember, the product links are in the description below, and I'm going to continue on the service. And remember, makeup is an art and skincare is a science. See you next week.